Did you know that if you have a picky eater, or your kid has aggression, or if they have eczema, digestive issues, ADHD, or fatigue, any of those issues could indicate that your child has mineral deficiencies? Of course, there are more indications as well, but my point is that mineral deficiency can show up in ways you may not be expecting. My guest today is a naturopathic pediatrician that specializes in minerals and helping our kids and teens heal naturally. Dr. Nina Marie is passionate about empowering you, the parent, to be the primary care parent. And don't worry, we're not going to leave you hanging here. We're definitely going to talk about ways to address deficiencies if you suspect them. So listen in, and if you've benefited from this episode or this show in general, please leave us a 5-star rating and or review on the platform that you're listening from. Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Nina, thanks for joining me.
I am looking forward to this. Thank you so much for having me.
Yeah, I have just loved following you. I mean, you've really chosen kind of a different path in pediatrics. So can you kind of tell me why you chose to kind of go the naturopathic route and why pediatrics?
So I didn't start in either of these things. My husband and I went to Bible college, and so I thought I was going to be. Well, my plan was to be a teacher. Um, I'm still teaching, just in a very
Sure.
capacity. M- I got into the health and wellness space during my first pregnancy. So when I became pregnant with my first Jude, um, there was a woman in our church who taught birth education at child, like what a labor and delivery was going to be like. And so my
Oh,
husband and I took the class. It was 12 weeks long, and she covered so many different things, and she had different professionals come in as well. So like lactation consultants, etc. She had a massage therapist come in and teach the husbands how to massage their wives during labor. It was amazing. So we took this class, and it was there where I realized, gosh, there's so much that I don't understand about the body and how to support it. I should probably pay attention here, especially since I'm growing another human. I
yeah.
and so that I started to read a bunch. I'm a serial learner. I love to learn. So I just dove into books. And then this same woman was also a doula. So she was a doula for me in labor. And that just opened the world after giving birth to like the amazing wonder of childbirth. So
Yeah.
I became a doula first. I was a labor doula for a while, and then I kept having babies. So I became a postpartum doula for a while. And all of my clients, this is how I got into perinatal health, would ask me questions about nutrition and pregnancy. And I would tell them, like, well, my doula education didn't give me that. So I'm going to have to like research. And so I would spend time researching. And then I found the first nutrition program that I went through, a functional nutrition program, and did that so that I could better educate clients. And eventually as I'm seeing these moms as both labor, postpartum, and now nutrition clients, they started asking about seeing their kids. Moms open the door to the whole family.
Yeah.
Well, I'm like, I'm going to need a little more research. I have some ideas on how to help there. And so I pursued more training in functional labs. I pursued more training in pediatrics specifically. And so there's a lot of textbooks that I bought just to make sure that I was well trained and understood the complexity of working with a child and not an adult.
Yeah. It's very different. Wow, that's amazing. Such a cool story. It's really my kids that kind of brought me into the health and wellness space as well. I don't know, they just do that. No.
You realize your responsibility, and that changes you for the
Yeah.
better.
Yeah. And I mean, in my case too, we were, having some chronic illness issues that we weren't finding any answers for, and had to go looking.
So my firstborn, when he was born, my labor was almost 3 days long. It would start and stop, and I remember the doctors, the midwife, and the doula being like, "This is a little strange, not abnormal. It is your first." At my son's like 4-week checkup, I remember mentioning to the pediatrician, is this normal? He had a ridge on his forehead and you could feel it through the skin. And he had sort of like a pinched look, somewhat always angry looking. Um, and she wasn't a new pediatrician, but had only been practicing for maybe 4 or 5 years. And so she pulled in another pediatrician in the practice that had been working for over 20 years. And that pediatrician was like, "You need to go see a neurologist." And I was like, "Oh, that's exactly what you want to hear as a new mom with a 4-week-old."
Wow.
And my son was born with something called craniosynostosis, which is when the front suture is closed. And so you're supposed to have the soft spot on the head so that the bone don't malleable. His was closed, which is why labor and delivery would stop and start. He could not get through the birth canal. Uh, yeah. So he had to have surgery at 7 months. He had cranial surgery to be able to break essentially his skull back open so that his brain would have room to grow. And I remember like that was another like point in time or experience that pushed me into what does it mean to care for a child
Yeah.
and how I was being recommended to care for my child. That there were strict demands put on us prior to surgery, where had he not been having surgery, we would have said no to specific that they wanted us to do. Um, so I understand the like, what is it, the word I want to use here? The pressures of parenting a child with complex conditions at the beginning.
Yeah. Yeah. That's man, I'm so sorry. I can't imagine how hard all of that was to have a 7-month-old undergo such
Yeah.
a surgery in such a sensitive area and being a new mom. Oh my gosh.
I remember I used to work in an eye clinic and I was sharing with one of the eye doctors that he was going to go through surgery. And she's like, "Did you ask the doctor how many patients he has lost?" And I was like, "No, that's a really good question. I guess I should have asked that." But like those are things you think about. Uh, so it was definitely a trying time. I'm so glad to be almost a decade away from that point in time. But it is also one that helps to keep me grounded in compassion for parents because I understand the like anxiety that your kid's health can bring.
Yeah, so true. And I mean, you're such a powerhouse educator today for parents and helping so many. So I've noticed that one thing that you really focus on in your education is minerals.
Yeah.
So why is that? What is it about minerals that gets so much attention on your social media page?
So minerals are involved in every physiological process. They're involved in the brain's growth, in the brain's ability to communicate with the rest of the body through the central nervous system. They allow for the central nervous system to fire. So if your brain tells your hand to move, minerals are involved in that. They're involved in growth and development. Many minerals are necessary so that you don't have something like failure to thrive in a child. They're involved in hormonal production. So when your child goes through puberty, or you yourself are dealing with hormonal issues postpartum, minerals are involved there. There's yes, synergy. There are synergistic relationships between minerals and different hormones, enzymes, even vitamins, and antagonistic relationships. So they can be BFFs or they can be enemies, and opposed to one another. And so understanding their involvement in all of these things, in your child's capability to walk and speak, even helps you to see that something that is invisible to your eye, but visible in the food, like, you have food in front of you, there's minerals involved there, or in the food that you feed your child. They are essential to your body being able to do what it was designed to do. And so that's a big reason. Another big reason is it's simple to test. So there are different modes of testing minerals, and the 3 different modes give you 3 different pictures. You have urine testing for minerals, and that tells you what the body can excrete or has excreted or used. Um, you have blood testing for minerals. That just tells you what's in circulation. It doesn't necessarily tell you what's in use. And I wouldn't say that one picture is more important than the other. I think that they're just different pictures that give you an idea of what's going on with the whole person. And the third and easiest option, especially with a kid, is through your hair. And so I do hair tissue mineral analysis with children. You also get to test for heavy metals with that same hair sample. And we're looking at the relationships between all of those mineral elements. And I have patterns that I'm looking at depending on what your complaints are or concerns are for your child. So if speech is an issue, if aggression is an issue, there's even emotional components to minerals as well. To have that kind of data for your child is empowering as a parent to
Mhm.
taste, and so easy to test for the most part, and involved in everything. So if there is a complaint that you have or a concern that you have, I can guarantee that minerals are going to be a factor in correcting it.
Yeah, so one of my questions is why do you need them? And it's for everything.
Absolutely everything. I mean, any stressor, whether that's just growth and development. So a child growing from a human growing from its infant size to its adult size is a stressor. Like growing in childhood is a stressor, and you need to have an appropriate stress response to that. Minerals are involved in your stress response. So sodium is directly tied to your cortisol levels, and potassium is directly tied to your cortisone levels. And so knowing that we have appropriate amounts of different elements helps the body to remain calm in those times of stress,
Mhm.
aka childhood, and also like rise to the occasion of that stressor being growth and development.
Yeah. And if somebody is just like completely new to minerals, like just maybe they've heard the word but never really understood what they are, how would you describe what minerals are?
Okay, so in like any class I've ever taken, the popular illustration used is minerals are the spark plugs of life.
Mm.
I remember the first time hearing that, and I am by no means a mechanic, nor do I know anything about cars. And so that means nothing to me personally. So I had to have someone who is a mechanic explain that to me. I was like, what is a spark plug? What does it do? And his like very basic explanation to me was spark plugs are the things that let tiny explosions happen in your car so your car can go. And so I'm like, I think that's what I needed. Like, now I understand what a spark plug is. So minerals are the things that allow for tiny explosions to happen in the body. Like there's communication between cells, and that's a miniature explosion so that your body can do what it's supposed to do. And so that is what a mineral is. They are acquired through the food and drink that you consume, and they
Mhm.
are expended through every physiological activity that you do. And so understanding their need can help position you for great health.
Yeah. What are some of the minerals?
The most popular ones are going to be your electrolytes. So that's calcium, magnesium, sodium, potassium, chloride, things like that. And that have less popular ones like boron or manganese or chromium or sulfur or lithium, even. Well, lithium might be a little more popular than that. So there's so many. You can think about your high school chemistry class, your periodics table. That is what I'm discussing when I mean
Yeah. Yeah, right. Iron is a mineral, right?
iron is a mineral. Yes, it is. Iron is not one that I would focus on in hair
Yeah.
because we don't excrete iron very well through our hair. And there are so many other moving parts in understanding the body's recycling of iron, that blood work truly is better. You can get some clues in HTMA, but you don't want to depend on it for understanding iron. I will say that.
Yeah. So in your experience working with moms and kids, do you find that most people you test are deficient in some way?
That's a great question. There are definite deficiencies, yes. So I let me explain the nature of HTMA a little bit. So
Yeah.
the whole test is a test of loss because your body has wisely placed this mineral element in the protein structure of your hair. And the body knows that hair leaves. It's not the liver, which stays in the same spot the whole time. So, what we want to see in an HTMA is the appropriate amount of loss. And so, there is a reference range that would be quote unquote normal. And then anything below that can tell me you're not losing enough, which might mean that you might be deficient. Now, this is where HTMA can be a double edged sword, and you really need to have someone who understands the test. Um, not having an amount at the level of appropriate loss or normal loss does not inherently mean you don't have enough of that thing, because I have seen many retests where we've been working and you've been doing all the mineral things, we've been tracking them all, and your retest results like they all plummeted. Like they're now all super low. What happened here? In an instance like that, M I believe the body has sent those elements to where they need to go instead of losing it in your hair. And so
Mm,
you may see deficiencies. I think context is gonna play a role in how you interpret the test. And then the other flip side to that is you may see levels that are super, super high, but that doesn't necessarily mean you're getting too much of it. It could mean
mm,
that you're losing it too quickly, which happens in times of stress. So you might actually need more of that element. So again, context of what is going on in a person's life and potential like infections help us to see, is this a true deficiency? Is this a true loss? Are you supplementing with iron? Then that's probably why this iron level is high, right?
yeah,
All of those factors have to be considered when you're analyzing.
yeah, that's really interesting, and HTMA is hair tissue mineral analysis.
Yes,
Okay,
ma'am.
yeah, that is very interesting. That's a really It's almost a backwards way to think of it with the hair, like not testing what's there, but testing what you're losing, quote unquote.
Yes. Well, because your hair is a form of connective tissue, what you're
Mhm.
doing here is you're seeing what the body is pushing into storage.
Yeah,
And so if it's pushing this into storage here, that you can kind of reverse engineer. This is what's being pushed into storage elsewhere in the body, and there are specific needs in different organs. And so seeing those patterns helps you to know, well, this is why you're dealing with chronic constipation. Look how much calcium is being deposited into your tissues instead of your bones and teeth. That's just
mm,
going to slow everything down, including the intestinal tract. So it doesn't have that motility to move things through. So we now need to bring in appropriate cofactors to get that calcium out of your tissues and into bones and teeth. And so you might be considering magnesium or vitamin K or vitamin D in some instances to help get calcium where it's supposed to go instead of storing in your tissues.
yeah, I think that's really cool approach. And so if you do have somebody that is deficient, do you often find that it's been lifestyle factors that have kind of brought that about?
So when I'm talking about kids, most of the time it's inherited.
Mm,
What mom did to prep for pregnancy and how she ensured she had appropriate nutrients in pregnancy plays a
mhm,
big role in what happens to her child, because 10% roughly of her mineral storage will be downloaded into her child. And so some of those deficiencies in children are because of heavy metal toxicity that
mm,
came from mom during pregnancy. So, an illustration I use with clients, if your body is a parking lot, all of your parking spaces are assigned. So, these are your cell's receptor sites. And these parking spaces that are assigned are for minerals, enzymes, vitamins, hormones, all of the things that you need. There is absolutely no parking space assigned to a heavy metal. So what heavy metals do is they steal parking spaces. So lead is stealing the parking space of calcium. And if we don't get enough calcium to come in, the body is going to keep lead there because that parking space can't be left empty. It would prefer to have something to get some of the work done versus nothing and none of the work done. And
yeah,
so when that happens, if mom has a ton of lead sitting in her calcium parking spaces or cadmium in her zinc parking spaces, when it's time to download to baby, that's what baby's getting. And so most of the time, or oftentimes, I won't say most, oftentimes, some of those deficiencies are inherited because of what happened preconception or during pregnancy.
right. And then is there kind of a tipping point, or an age where you're like, "Well, this is probably more your lifestyle now than what you got from mom?"
Um, I have seen too many parent-child tests at varying ages to say, this is the age where it's now just
Right,
you. There's so many of the lifestyle factors are gonna be the same. You still
right.
see similar testing results. So maybe if I'm gonna give an age, definitely when you're a teenager,
Mhm,
because that's when kids wanna make their lives their own the most. Uh, but even then, because there's so many lifestyle factors that are similar for families, you'll see those similar patterns. And so what often happens is if there aren't many changes made, those lifestyle factors are just going to cement the inherited mineral patterns, so to speak.
Yeah.
And they just, unless changes are made and focus is taken to minerals and other things, then those things just continue.
Yeah. Yeah, I mean,
Also add, sorry, um, not to like put blame on mom because that's not at all what I want to do, right? It's definitely not just mom. One, there's mom and dad who create a child, but also there's a lot of lifestyle or environmental factors that can affect a child as well. So um, there are metals in our food, metals in our water, metals in the air that we breathe, metals in the ground our kids are probably running barefoot in. And so metals are not something that we're going to avoid. And if we aren't ensuring adequate nutrient status, then those metals are going to steal parking spaces. Maybe you did an amazing job with preconception work and taking care of yourself in pregnancy, and you're still unsure as to why your child may have problems health wise. There's so many environmental factors that can disrupt our minerals as well as other nutrients. So I want to also encourage parents to know you're not at fault. There's way too many factors involved. But it is something that can be corrected and rather simply.
yeah, I think that's really smart to connect, and you're right, like, on both accounts, so, the parent-child relationship is gonna be lifestyle-wise so similar, that it makes sense that they're gonna have similar outcomes on something like an HTMA, right? But then there's, like, the genetic factor of that, and there's the lifestyle factor of that, right? So and being empowered with knowledge of things like these environmental factors that impact us and impact our health negatively should never be something that causes shame in our lives, but when we have that knowledge gives us like the power, right, to
Absolutely.
then make changes that
I
that
mean,
are positive.
I'll give a prime example. My firstborn son, I love you if you're hearing this 20 years down the line. He is the if I had to use this term, I would use this term. It's not how I would describe him. He is the most sickly of my 3 kids, and I did not do any preconception care, and it wasn't until, like, month 5 when I took that class that I realized, "Oh, I should probably take care of my body now that I'm pregnant." And so he's the child that has the most health issues, and my daughter, who is my 3rd, is the one that my husband calls the pure blood because nothing takes her down. Like, she's the one who has the best health in our family. And so I can see in my own children, like the care that I took for my first and the care that I took for my third were very different and their outcomes are very different. And so um I again understand the like complexities that come with
Yes.
your own choices as a parent or as a human pre-parent even
Yeah.
and how they impact your children. So I see
You only know what you know, you know?
exactly. I see it. I understand it. I don't shame myself from not doing anything better. Like I know what to do now and I'm caring for him now and that's what's most important.
Yeah. Oh my gosh, this story is so relatable. Same story in our house. Like our oldest probably has the most health struggles, the most gut issues.
Yeah.
We've had to work the hardest with her to kind of reclaim her health. And our youngest just like, have you ever been sick? I don't what?
You look around outside and nothing happens.
That's awesome. One thing that you've kind of talked about here and there so far are some of the things that you have seen in children that have been related to mineral deficiencies. So symptoms, if you will, of mineral deficiencies, which I think are kind of surprising because you've talked about, delays or speech, aggression, things like that. So I'm just curious in the work that you do, like what are kind of those things that just really glare at you and be like, oh, you need to work on your minerals.
So aggression is definitely a big one. When I see aggression, one of the first nutrients that I'm considering is sodium because
Mm.
aggression is a stress response. Okay, if we were living in the wild and a bear was out to get us, our flight or fight response would be kicked in. And when we have our fight or flight response kicked in, this is not the time to make friends. My life is on the line right now. I either need to fight you or I need to run away from you. And so if there is a stress response on that aggressive behavior, that kind of aggressive behavior comes from that. So it's not time for me to like be open and friendly and joke around, but I can't. I physically cannot because the body only has one physiological response to stress. The brain perceives the stress. Sometimes it's not even real. It is a perceived threat, if not an actual threat. And then it communicates to the adrenals, you need to secrete some cortisol because we need to run or we need to fight. That's it. So you could be sitting in traffic and have your stress response. You could be upset because your brother took your last French fry and have a stress response. You could be, you could have poor GI microbial balance. And because it's a chronic infection, we now have increased cortisol and have the same stress response. And so understanding the relationship between any of those scenarios leading to aggression, all of those things will also lead to mineral imbalances, one of which is sodium. It's tied to your cortisol levels. It's also often tied to high copper levels. Copper, after the liver, is deposited into the brain. It's a secondary storage site, and you don't want excess copper. Copper should be moving and be used or eliminated. And so, oftentimes, high copper can lead to aggression because of where it is deposited in the brain. It's the emotional center where it gets deposited. Zinc is often low, which is the opposing mineral for copper. It keeps copper in check. Um, Iron is often high, and that typically is because there's an infection occurring. Iron will increase in storage in the body because of infections. And then there are different heavy metals like mercury because of where they deposit in the brain that can lead to aggression too. And so you have all of these moving parts. And so,
Right.
I mean, a 2-year-old, a 3-year-old, there's normal 2 and 3-year-old aggression, right? Because they're 2 and 3-year-olds. But I also believe that a parent knows when the aggression is beyond that. And I've had several parents share with me, like, I've even said this to my husband about my middle son at one point. Like, I know that what we are experiencing is more than just little boy tendencies. And if you as a parent have those thoughts, trust your intuition. There's never been a parent that I've worked with that was wrong. Like, no, there were things, big things going on. And there are big things that can be corrected. And when you do, I've had so many clients tell me, I can't believe how calm my child is. It's like a whole different person. And just because you were changing what you were feeding them, how you were feeding them, adding some mineral drops in water throughout the day for them, like very small tweaks can make the biggest difference. I've had some clients where they have high copper coming in through their water because of the copper pipes in their home. And so just adding in a water filter can be a lifesaver for some people. So understanding any of those factors, like it may be that your kid is just 2 or 3 and that's just something you're going to have to parent through. It could also be that there's any number of things that is leading to a stress response in the body, which leads to that aggression.
Another one I think I've heard you talk about is picky eating. Can that be related to deficiencies?
Yes, it can. So this is another one where I'm like, okay, it might just be like your kid is, you need to parent through it.
Being stubborn, yeah.
Yeah. So I have one of those. But the one that I have, my picky eater, has changed drastically when I started including a specific supplement for him. So the main nutrients that can be low are zinc and calcium. Um, you can also see iron low. You can see phosphorus low. So zinc and phosphorus are related here. Uh, they are both two nutrients that come from meat, preferably. Most of they're easiest to absorb from meat, I should say.
Right.
Um, and zinc in particular, every picky eater that I've worked with was low in zinc. And zinc is related to your taste buds. It helps you to taste food as it's supposed to be tasted.
Interesting.
And so when kids are low in zinc, food tastes weird and it doesn't taste good because their taste buds aren't functioning appropriately. And so I'm happy to share this with you so anyone can download it for free. I have a
Yes.
eater protocol that uses a calcium, magnesium, zinc supplement that's pretty inexpensive that you can get. And it gives you the dosing based on like age or weight. That is probably where I would start before moving into any like expensive testing or looking at the gut, because sometimes it's just a nutrient thing that if we correct it, they're a little more willing to be adventurous in eating. My son, we were doing this calcium, magnesium, zinc supplement for like a month. And then, and I've had some clients who are like, in 3 days, it was like night and day. My child, it was a month. So please know that it could be more than 3 days. It was so different. I remember one night he was grabbing things from our dinner, because we do the like serving plates. He was grabbing things from the plates and things that he would never eat and just eating them. And I looked at my husband like, oh my gosh, did he just do that? And he's grabbing more. And so we told him like, do you realize that you're eating these foods that you said that you would never touch? And he's like, yeah, I like them. And I'm like, I'm so glad that you're trying that. Like I it's wonderful to see now. He is a very different eater than he was. This is more recent. So like 6 months ago. And it's fun to see him realize like, "Oh, no, this actually does taste good," and the only difference we made was bringing in that pretty he did not like the taste, but I told him he had to take it, whether he
Yeah. Yeah. That's amazing. I love that. I feel like that could give parents a lot of hope. Like, like, we're really struggling. And I mean, other things that they could be struggling with that are pretty common, I feel like not sleeping well
Yeah.
and eczema, um, ADHD. Those are some things that I've heard you talk about.
Mhm.
Uh, relationship to like Lyme disease and things like that,
Yeah.
which is something that I've tried to pay attention to for my son.
So for eczema, that's a big one with the kids that I work with. There are actually a lot of elements involved in eczema. Calcium is often low, and I go back and forth whether or not it's a deficiency leading to eczema or deficiency in response to it, because so many people will eliminate dairy, and dairy is the easiest way for your body to absorb any calcium. I'm not sure if that's a chicken or the egg scenario with calcium, but I know it's there. Magnesium is often low, potassium is often low, phosphorus is often low. Um, there's often actually so calcium, magnesium, sodium, and potassium. Those are your main four elements on a test. They're often low together, and that creates something called the four lows pattern. Um, there are many heavy metals present when eczema is present. Arsenic, aluminum, cadmium, mercury, lead, thallium, rubidium, nickel, tungsten, platinum. There's truly like very many
Wow.
metals that can be involved. But the main two or the main element that I would look to for any skin condition is also zinc here. This is known as a skin mineral. It's important for your skin's um, elasticity. It's important for your skin to not be dry. And so sometimes that can be involved. So picky eating and eczema often also go hand in hand, and that
Mm.
is a big player for them. Um, for ADHD, I think you mentioned,
Yep.
oftentimes we see low magnesium. Magnesium is a huge element that can be beneficial in ADHD. There are different, this is the first time I'm mentioning this, but there are different forms of minerals in supplements. So in order for you to be able to absorb a mineral in supplement form, it needs to be bound to an amino acid.
Mm.
Um, if it isn't, and I'll say it this way, some amino acid bound minerals are better than others. And so when it comes to ADHD, magnesium threonate is the type that is most beneficial. Any like brain related thing that you want magnesium with, that's the type that you're going to want to look for on the label. Um, there might be low copper or high copper with ADHD. It really can be tricky. So this is one of the elements that you don't really lose much in your hair. And so it can look low, but that just might mean that your body has just kept depositing it in your brain and it's not going anywhere else. Uh, but it can also be high, which shows us, oh, we've got a really big overload in the body's trying to eliminate it. You can see low iron, that has been a big one. There's even been some studies that point to low iron in the brain for ADHD. And so specific parts where the brain is supposed to be using iron, there wasn't enough. one of the biggest things that I see for low iron, especially in instances where there's behavioral issues like this, are parasites. Um, Different pathogens will feed on iron, and the body will try to shunt iron away from feeding a pathogen. And so we can see this low level or high storage sometimes. And then there are also heavy metals like mercury, lead, or aluminum. Mercury and aluminum are known to be deposited in the brain too. And so those are ones that you want to pay attention to. And there's specific antagonistic nutrients that we can use for those metals. So you don't have to do this big heavy metal detox. Mineral balancing helps you to move those metals out of the stolen parking spaces so that the appropriate element gets there.
Yeah. So is there any danger in that? Like, I've heard a little bit about, when you're trying to kind of flush heavy metals out, that there can be a little bit of, I don't know, kind of like stirred up toxicity in your body. So,
Yeah.
with your just trying to kind of, I don't know, naturally take care of them by giving your body more minerals, is there any danger of that? Do you have to be careful of that or not?
So when you are mineral balancing, you will inherently move metals out. And so I always have a binder when we're working on bringing in a ton of metals in. The binder depends on the test results. There are some that I would prefer for like a high copper person
Mm.
that I wouldn't use for everyone else.
Okay.
There is like diatomaceous earth is high in silica, which is great for eliminating aluminum. So if we have a ton of aluminum, that's probably the binder I'm going to want to bring in. So I pick and choose depending on results.
Right.
Um,
But sometimes there is a binder involved just depending on their situation. Yeah.
every time we're if like we're bringing in an influx of minerals, we're also bringing in a binder.
Okay.
Uh, at least for the first 60 to 90 days. I don't like to stay on binders long term. I always love to bring in food-based binders as soon as possible. The more you can poop, the more your body is going to be eliminating those metals and toxins. Uh, so there's that aspect. When it comes to some of the chelation therapy, heavy metal detoxing, my concern there is yes, we like brought a tow truck and we took that heavy metal out of that stolen parking space to eliminate it, which is wonderful. But if we don't have something to replace in that parking space, then we just have the opportunity for another metal to come later and sit there when it wasn't supposed to. So as helpful as a tow truck is, if we don't have the right car to get to where it's supposed to be, then because of our environmental toxicity, we're just going to continue to have heavy metal toxicity. I know of a woman who was on a heavy metal chelation therapy detox for over 2 years. And I was like, well, did you ever address minerals? And she's like, no. And I'm like, well, that's probably why. Like, you
Yeah.
becoming metal toxic because your environment is, everyone's is, and you didn't focus on how do I help my body to do this on its own? And
Mm.
minerals are a really big key in that.
Yeah. Since we've talked about some different ages of clients that you've worked with, are there different mineral needs for kids versus teens versus adults?
That's such a great question. I don't know that there's any blaring. Well, you know what? That's a lie. I can think of
I
some.
mean, we all need all the minerals, right? I guess, is there, I don't know, something that's kind of more prominent or at work in different stages that's more important? I don't know.
So before, well, I'll put it this way: a human being should be born with something called fast oxidation, so a fast metabolism. And there's a specific pattern that you'll see with minerals for that. Calcium and magnesium are typically low in fast oxidizers. Sodium and potassium are typically high. Again, high stress response, sodium and potassium are involved there, and calcium and magnesium are really important stature building nutrients. And so the body is going to, there are lower amounts because there's so much growing happening. So if I have to point to a need for children, top two would be calcium and magnesium. And for adult sodium and potassium, it's usually flipped. There's way too much calcium and magnesium and way too little sodium and potassium. Um, and then you have every variation in between with any age.
Yeah, that's really interesting. I think that makes sense though, what you said, like just depending on what's happening in the body during that stage of life.
I mean, I've seen a 2-year-old where they had a slow oxidative type and way too much calcium, magnesium for their age and way too little sodium and potassium, and so there can be that, again, that goes back to, like, what happened congenitally. Uh, but if I'm gonna give a generalization, usually it's very low cal mag and really high sodium potassium.
Okay. And do you help people address this with food or
Oh, yeah.
supplements, or what's your go-to?
All of the above. So, most of the time, I'm working with a lab in Canada that will formulate one custom blend, and it'll have the minerals you need and some vitamin cofactors you need, and even some amino acids, depending on what we're seeing. That way, you've got mainly one thing to track during that time. I've had some kids' results where I was like, you really don't need a huge blend. Like, you could just do the CalMag Zinc supplement, and that's all you really need. Go with that. So it depends. Most of the time, I would say like 90% of the time, we're going with a custom blend. Super simple to track. You'll do this for 3 to 4 months at most. We could retest at the end, make sure things are moving in the right direction, and we see some wonderful wins.
It's amazing. Can you give me an example of some turnarounds that you've seen?
Oh, yeah. So just today, I shared about a client that I've been working with. She's 1.5. I think we started working together right before her first birthday. And she's had chronic constipation almost her whole life.
Mm,
And it was so bad. Like every bowel movement, she was screaming in pain because it would be days in between a bowel movement. And her mom, bless her, like would like sit in the closet with her to try to muffle her screams because of neighbors. Like that's how tragic it was. And she just messaged me yesterday, like she's having regular bowel movements and the pain for bowel movements are like gone. She might like wince and both mom and I are like, I think it's just habit now. Like there's
mm.
no real pain. We not try to help her to understand that she doesn't have to wince because she's fine. She plays, she giggles. Her mom said like she's moving in ways she's never moved before. Like she's so much more relaxed. And so that was months of work. Like this was a very complex case. There were a lot of other things going on. It wasn't just minerals. Um, but to know like this girl who was screaming anytime she had a bowel movement and like bloody murder crying
Yeah.
able to just play like a normal child who would after they had a bowel movement is a wonderful, accomplishment. I
Yes.
um, children a child with what is it called? Pandas? Yes. And this young girl also had an autoimmune thyroid condition, and so there was a lot going on with her, and it took also several months of working together. Those are more complex cases where we are doing various things to help bring some balance to mineral levels. And I remember when mom was like, she doesn't have to run around the yard 9 times anymore because kids with pandas usually have OCD, or everyone doesn't have to enter the front door through a certain way so that she's okay. And everyone doesn't have to wash their hands every 5 minutes so that she's okay. So, like, seeing kids be normal kids, I remember one mom he would like her son would wake up in the middle of the night and vomit. Like, just wake up, throw up, and then go back to sleep. He was 9 or 10. And, we worked on minerals and we worked on GI health, and within a couple of months, things were really great. He had more energy. Another thing that was wrong with him was he would, like, just be so tired and didn't want to have soccer anymore, and she's like, "My 9-year-old kid should not be so fatigued, like, he comes home and just wants to sleep." And so he was playing in sports again, and at one point she's like, "Okay, so what do we do next?" I was like, "Your kid can go live his life and be a kid. You don't need to do anything else, like, just enjoy life." So that is my absolute favorite, um, statement to tell people, like, "You don't need me. Enjoy your life. If something, like, comes up, feel free to reach out. We can troubleshoot if we need to, but my goal is to, like, let you enjoy life as you should."
Yeah, that's amazing. I love that so much, and just such a simple thing to wrap your mind around, really, like a concept, you know? I know minerals aren't that simple, but, like, the idea of minerals being so beneficial, right? That moms just don't know, and so I'm so thankful for you sharing all those examples, and I know there's mamas listening just like, "Oh my gosh, I this could be our answer," you know?
It is my favorite to share because I want parents to be empowered. to be able to do this for themselves and for their own families.
Yeah,
It has transformed mine, and so I would love to see that happen for others too.
for sure. Anything else on your mind that you would just love moms to know about minerals?
It's not as complex as you might think it is. Like, don't think that minerals are your freshman year chemistry class. It's not that. It really is just going back to whole food sources. If you are able to focus on whole food sources, you're already light years ahead on what someone needs in minerals. If your diet is more processed than you think it should be, then that's probably the first step that I would encourage any parent to address or to take, because processed foods have lost a ton of their mineral and vitamin element. That if you can go to foods that are less processed or the least processed for your affordability, that's also going to be a huge change. So focusing on whole foods will bring you nutrients that your body needs, including minerals. And then another free resource would be looking up your local municipality's water report. See what's in your water and in your tap water that might be cleaner than going to a third world country, but still needs more cleaning up. And so know what's in your water. And then from that report, you can decide what kind of filter you need. There are so many people who don't need the most expensive filters because their local municipality does a really great job. There are
Mhm.
other people who do. And so I would say free resource, go to Google your
Yeah,
your town water report, see what's in your water, and then from there decide, oh, we've got way too much of this metal or way too little of this nutrient. Let's make sure we're focusing on these things in our diet.
yeah. Should we be filtering things like chlorine and fluoride?
Oh, yes.
Yeah.
Absolutely. Please do.
Yeah. Yes, awesome. And how can people keep learning from you and kinda connect with you further?
You can find me on Instagram at Dr. Nina Marie, and doctor is the whole word. Um, I answer all of my DMs, so please feel free to send me a message. I'm more than happy to share what I know. I'm often sharing resources there. I love to teach. I love to empower parents. So please send me a message.
Awesome. Thanks so much for your time. I so appreciate you.
Thank you for having me.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.